All right, now we're going to look at menopause. What is menopause? So this is the male version of menopause, as we talked about before. So this is an instance where during a man's life where the androgens in his body begins to decline, right? So the testosterone levels in the man begins to decline. Usually this begins, again, these age of onset is very variable depending on person, race, the environment, right? The lifestyle. A lot of things can actually cause a decline in the levels of testosterone for this person, right? But usually what happens is there's an instance of atrophy of the male gonads, the testes, right, where all the testosterone is being made. And so these people that experience menopause have a decreased level of testosterone. And we said, what does testosterone do? Specifically for females or males, right? For males specifically, it's asking for increase in secondary sex characteristics, beard, the thickness of voice, and gamete formation, right? So generation of sperm. So when men go through this instance of menopause, usually, again, it's all variable based off of person, they experience this instance of infertility, right? And so this decrease in testosterone leads to a lot of all these other problems that the testosterone was facing in the beginning, right? So for example, these patients experience instances of erectile dysfunction, right? So they can't maintain any erection. They have a decrease in libido, so they don't have this sexual drive that's been present, right? So let's write that down. So they have instances of ED, erectile dysfunction, decrease in libido, right? So they have no sexual drive. What else can happen? You know, their secondary sex characteristics can be reversed, so their voices can go up, become more higher pitched, so they're not deep anymore. So, you know, increase in voice, so higher pitched voice. The hair begins to decline, right, in their body hair. So decrease in hair, body hair specifically. You know, their beard begins to decrease, right? And this all has to do, again, there's many, many more changes that happen, but for the sake of time, let's just focus on the basics. And so all of this mainly is because of the low or absence of testosterone. So there's no more testosterone that is present to give these kinds of characteristics, right? So if I were to ask you, how would you treat someone with menopause or andropause. Another name for it is andropause that I heard. But again, andropause can be not only relative to age, it can be also congenital as well. That's why they use menopause, right? So what would be a treatment for some of these people? So the treatment option for patients with menopause is ART. So what is ART? It's androgen replacement therapy. All right, so they find some kind of synthetic testosterone to give at very low doses in order to reestablish this phenomena, in order to decrease these negative symptoms, the negative signs and symptoms, right? And so ART is very effective. However, patients that go through menopause experience certain instances of vulnerability to other pathological conditions. One being said is prostate cancer. Right, so patients that have, for example, already pre-existing conditions like benign prostatic hyperplasia, right? So benign prostatic hyperplasia is this where your prostate grows. It's a tumor formation or abnormal growth. However, it is benign, so it's not dangerous. And they have some kind of family history of prostate cancer. This can actually be dangerous for these patients because a lot of patients that experience this ART, right, and they want to replace this hormone in order to regain certain lifestyle changes that they've lost because of this phase of their life, they can actually be prone to these conditions because testosterone migrates to that specific region, actually amplifies benign prostatic hyperplasia and instances of prostate cancer present, right? So again, it's a very risky therapy, right? But again, through proper monitoring, right? So if you go to the doctor every 3 to 4 months and check your certain blood levels, like your PSAs, get a prostate exams, right? You know, do the rubber glove thing. This will not be an actual symptom, right? An actual prognosis for the condition, because if it's caught early, these conditions can also be reversible.